Well, guys, I really wanted to make a video on what are the right ways to choose your transplant surgeon, because I had enough feedback from many patients. Most of the guys falling as a prey for kind of financials, like a low budget transplant, number one. Number two, surprising to my knowledge, some guys are just talking about instrument name and going to such clinics. Some guys are talking about technique name and going to such clinics. Some guys are falling a prey for advertisements where technicians are doing transplant. Some guys are falling for hype. Hype means showing some kind of celebrity or like a turkey advertisement. These are the hypes. So in this perspective, most of the guys are missing best surgeons. Good surgeons are not getting their services to you. End of the day, they'll just walk in and say, oh my God, I just did my transplant, kind of a botched transplant in Turkey or botched transplant somewhere in India with technicians. They say, I really don't know how to choose it. So that's the reason I really want to make a video to make you understand what are the important points you're supposed to first look into before getting your transplant done. So those points I'm going to explain today. I think this video will help you to choose at least 80 to 90%. Beyond that, probably you can do your own research and choose one. There are many categories we can talk about, but basic things I'm here talking about. 3 important points. Number 1 point is know your surgeon. Number 2 point is know his results. Number 3, know his clinic facilities. These 3 points, if you can observe very keenly, probably you would get enough information on 80 to 90% on a surgeon or a clinic. You would not go wrong. So these 3 points are most important. There could be many other points, because these are the 3 main points that you should understand. When we talk about know your surgeon, kindly see surgeon's experience. Experience in the sense kind of 5 years, 10 years, 15 years, 20 years. That makes consistent work, experience, expertise in the field would give you a little idea about surgeon. So that's the first thing. Number 2, make sure your surgeon should know all techniques, because hair transplant been evolving from many micro grafts to FUE, and we were doing 2006 to 2014. I was practicing something called a strip technique, the gold standard technique in hair transplantation, and that is called a FUT technique. Now we are going to do micro FUE today. This means handling FUT case is kind of challenging when compared to the FUE. If your surgeon know how to do FUT, how to handle that kind of complications, would definitely do better job with the FUE. That's the reason. Make sure that your surgeon know all the techniques and was ready to learn new techniques. Otherwise, he never get updates. He would not do better surgery for you. This is the one thing. A third one is choose a responsible surgeon. Responsibility is supposed to take. Not only doing surgery, post-operative care, a responsible surgeon, honest surgeon. Because most of the guys walk in with many medical ailments like having diabetes, having hypertension, many other elements they don't even look into. So you have to have a honest and responsible surgeon to avoid all those complications to get you a safest outcome, because probably you would lose the hair transplantation failure, hardly you lose hair. But if you lose your health, which is not at all inevitable, so definitely you should choose a responsible and honest surgeon to do your hair transplant surgery. And your surgeon able to do repair cases also, because if he's able to handle repair cases with the results, and also if something goes wrong with your surgery, he can repair your case. That's the important point to be noted, because repairing a transplant surgery is not a joke, because you have left with less number of the grafts and patient has a lot of expectations. So once someone has filed a transplantation, that means your surgeon is going to repair it. You can understand the caliber of the surgeon that you're going to go. So obviously your surgery definitely can be better. Even something goes wrong, he's going there to help you repair your surgery also. This is another point. And choose a passionate, energetic surgeon who has an aesthetic sense, who can understand your future goals and your future hair loss, and can get you best outcome for you. Second point is noise results. Most of the patients told me and gave me feedback about results. They say, I have seen lot many videos, but when you just go into deep about the videos and details, they say, I had seen a video, but patient was talking to doctor or they're putting some bandage or, 5,000 graft they implanted, this is a picture they posted. That's not the proper video for you. Patient should watch before and after results only. There's no point if someone is posting you today I have done a transplant 6,000 grafts, 8,000 grafts. That doesn't make any sense to patients. Rather, we should not even post that kind of pictures according to our councils. Now, all the way patient needs before and after results, because imagine to record the results, it will take 8 months to you. Whereas recording a bandage and recording a kind of a consultation can hardly take 2 minutes. That is also video, this is also video. Kindly do not count on such kind of videos. Make sure that you are watching a video before and after. It will take 8 months for us to record a video, and you can understand the consistency. You can understand the quality of the outcome. So these are most important. Most of the people are just getting fooled by looking those videos. One video they keep it 100 times. Not that. So check for the consistent results, continuous results. Every day by day, week by week, monthly, are they updating videos and everything to you? So that would give you a kind of a track record to you, which is most worth the noting point. Next point is about results. Only having some hairs on the scalp doesn't make any sense. That happens with kind of amateur surgeons, technicians and quacks, even Turkey hair transplants. Kindly make sure if you transplant someone who would understand half a mile distance, it doesn't make any sense to you. Rather, being bald is better. So when someone does a transplantation, it should look very natural, artistic stuff, so that you have hair having no attention to it. If everyone can make out it's a transplant done for you, then obviously it's a flop transplantation or a botched transplantation. This is another important point. Next one is also should watch your donor management. Most of the guys, especially Turkey patients I've seen, they spoil complete donor. One harvestation they do, complete donor has been botched and depleted, and you would not do any further sessions to you. That's very important to know. Your surgeon should focus on future hair loss and future transplants. Donor should be well maintained. Balanced donor management should be done. That means you should harvest within safe donor limit. Those things you need to talk to the surgeon and get explanation about why you're going to harvest only this many grafts. Otherwise, you will have hair, backside you completely depleted. If you lose more hair and you have a big patch in the crown area, which doesn't make any sense. When we further talk about repair surgeries, kindly watch repair surgeries results. I've seen most of the guys putting, I repaired this patient today, but they never show the results. That doesn't make any sense to you. Watch repair results after 8 months. Someone is capable of doing repair surgeries because someone has already botched, having a less donor, very kind of difficult, it's a challenging to a surgeon. If you get to see that kind of results, good results, I'm sure you can trust them and you can get it done your transplant. And that's the really important point to be noted, and you can assess the surgeon's capacity and caliber and aesthetic sense. So repair surgeries with the results, you should also make a point, and this point to be very important to understand the surgeon expertise too. When it comes to surgery, not only surgery done, you should also know post-surgical care assistance. Imagine most of the guys show a lot of energy before coming to consultation or before surgery, later on they disappear, which is not worth to you. You have to have a kind support from the surgeon or team until you get good progress. 6 months, 8 months, 10 months really makes sense to patients. Kindly watch this kind of assistance who's going to give you. Imagine someone is not going to give you post-surgical care assistant to you. It could be a very silly question for me, but for you it is a big question. Can I use shampoo today? Can I rub my hair? They ask you. Probably it sounds very silly for most of the doctors, but it is not silly for the patient. It's the first time he's ever coming for this kind of treatment. You would have spent money and time on it and research, and he's leaving your head under your knife. So obviously they have a lot of questions in their mind. It should be very silly. It's very serious to the patient, should be answered. Then only you get nice support from the clinic. This kind of assistance post-care assistance after surgery is very important point to be noted to choose the best surgeon and best clinic. Last one is about clinic facilities. This clinic facilities means how responsible your surgeon is, because are they using disposables properly? Are they disposing all this surgical waste properly? Otherwise, we are going to waste Mother Earth. One thing. And some guys ridiculously use used instruments. I've seen such kind of quacks doing transplantation. People are getting transplant done with them. It's really ridiculous, and kindly do not ever go to such clinics, because and the instrument itself you buy from India, kind of instrument you get probably not quality one at times. Only few we can buy here. We need to segregate which instrument to buy where. Most of the time I buy from Medicube Surgicals from USA or Schwann from UK. Basic things you can buy here. Surgeons should know the quality of the instrument. If the quality is not good, you can get definitely good surgery. The quality starts from clinic hygiene, surgeon's mindset, surgeon's aesthetic sense. Everything makes an important role in these clinic facilities, which can fetch you a hygiene transplant, good transplant, and nice aesthetic results. And second one, how they are cleaning the operation theaters, how their sterilization protocols following. Because being a surgeon, I know how to sterilize the operation theater, how to sterilize the instruments, how to kill the airborne bacteria. All this procedure every day should happen. After the surgery, it takes 1.5 to 2 hours to clean the operation theater by doing a fumigation process, by doing ultraviolet rays, whatever it is. So this should go each and every surgery after that, it should happen. And these steps should be followed very meticulously and strictly. Otherwise, there's a lot of chance of getting contamination and infection. That also I've seen in some clinics. That should not happen. So here, surgeon quality mindset definitely plays an important role, because that costs you more to maintain all this well clinic hygiene and making the fumigation process every day. Definitely costs you more, but you should not compromise on that. So this part none of the patients will be looking into, because they don't even see. Because I have seen patients going to clinics where 100 by 100, a small clinic, everything is there done, implantation, harvestation, everything, and they'll be using the same slippers, bathroom and inside the operation theater. That should not happen. Operation theater slippers are different. Operation theater dress is different. This dress should be sterilized every day. So these are the most important factors. Most of the patients are missing it. So kindly have a look on all these kind of important factors which is going to involve in your surgery, contamination and infection also. Another important step in clinic facilities is when patient walks into consultation, surgeon should have guts to say no for some cases, because they could be medically compromised, having a diabetes, hypertension, kidney ailments, many things they will have it. So most of the time, if you go to under kind of amateur clinics or kind of technicians, especially even Turkey, these guys not even know about your health status. They simply take you for the operation theater, which is not good for you. I have rejected many surgeries on the routine basis, because most of the patient, once we reject it, they will really get offended and they don't even talk to us. But still okay, because someone has a high sugars, it's deadly dangerous to go with hair transplantation if it's not under control. Only under control we can talk about it. Okay, and someone has a kidney problems, heart problems, we need to go thorough examination with blood investigations, and we also have guts to say no for such patients. A really important point to be noted. So every person can do surgery. It's not a big deal, but who's going to say no for you? Why? That is the most important point to be noted. That also comes under all this kind of responsible and honest surgeons capabilities. Kindly choose these points. I don't think you miss more than 80%, 90%. You can filter about these points. There could be many other reasons to choose many clinics. Nowadays, everything getting kind of reviews, all kind of patient testimonials are getting faked much. All paid stuff is coming out, which is not worth. But certain extent, consistency, results, how responsible your surgeon will definitely make you go to end up in a best surgeon's hand. At least you will be in safer hands to get your transplant done. Thanks for watching our videos. Kindly watch our further more videos for new updates, and thank you so much.